Depression is often associated with sadness and withdrawal, but sometimes it shows up as irritability and anger. Recent studies show that extreme anger, particularly in adults, can be a telltale sign of unresolved childhood trauma. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Anger is a normal human emotion experienced by everyone at some point.
No! God, please, no! No!
However, extreme anger is different. It's more intense, frequent, and often disproportionate to the situation. For example, a minor inconvenience like a canceled appointment might trigger an explosive outburst in someone struggling with extreme anger. This kind of response can be puzzling and distressing for both you and those around you. It can look like the person blowing up is doing it on purpose, but in most cases, they are not able to control it and may even feel a lot of shame about it afterwards. This is the difference between a person who uses anger to punish and control and the person whose anger stems from trauma and depression. It can be very scary to not have much control over your emotions like that, especially when you explode on people and you see the fear in their eyes. An interesting finding from the research presented at the European Psychiatric Association suggests that childhood neglect may have a greater impact on creating this anger response than the trauma of physical abuse. What is childhood neglect? Childhood neglect refers to a situation where a child's basic needs are not met by their caregivers, and there's several types of neglect. There's physical neglect that happens when a child's needs for food, shelter, and clothing and hygiene aren't adequately provided for. And this kind of neglect can lead to malnourishment, poor physical health, and developmental issues. Emotional neglect involves a lack of emotional support, love, and attention. And this can happen when parents or caregivers don't engage with the child, don't provide affection, or fail to offer support when the child is distressed. And this can lead to difficulties forming healthy relationships and emotional development problems. Educational neglect occurs when a child's educational needs are ignored. Parents or caregivers may fail to enroll the child in school, allow frequent absences, or not attend to special education needs. And this can result in learning disabilities, poor academic performance, and limited job opportunities in the future. And then there's medical neglect, which involves not providing for appropriate health care for the child. And this can include ignoring medical recommendations, failing to provide necessary treatments for injuries or illnesses, or not taking the child for regular medical checkups. And this can lead to serious health problems or worsen existing conditions. So why would neglect be more damaging than physical abuse? One theory is that neglect, especially emotional neglect, can leave deeper scars because it involves the absence of essential positive experiences. A child who is abused physically might still receive love and care at other times, providing some balance. But a neglected child may never experience this essential nurturing, leading to a profound sense of loss and emptiness that can manifest as depression and extreme anger in adulthood. Your anger can show itself when you're not depressed, but not as intensely as it does when you're depressed. Medication may help some of the depression symptoms, but the anger may still be a problem. The way to break through this anger issue is to work through healing the effects of the trauma. A self-help approach to addressing your childhood trauma is to use techniques from acceptance and commitment therapy. This isn't the only way, but one approach, and this approach encourages you to accept your feelings and thoughts without judgment. Here are 9 things that you can do to process your anger with self-compassion. The first step is to recognize and acknowledge your anger. Understand that it's okay to feel angry. We're not talking about how you express it, but simply feeling it. Anger is a normal emotion that everyone experiences. Then you want to pay attention to what triggers your anger. Is it specific situations, words, actions, certain people? Recognizing these triggers can help you anticipate and prepare for future anger episodes. Then you're going to be mindful. Mindfulness is about being present in the moment and observing your feelings without judgment. When you start feeling angry, try to step back and observe your emotions as if you were an outside spectator. This can help you detach from the intensity of the emotion and gain perspective. Because in the moment, you don't have perspective. You're reacting with the automatic threat detector that is your amygdala. Your amygdala senses real threats, but it also holds grudges and keeps a record of old threats. It doesn't do a good job of helping you discern what is a real threat and what is a false alarm based on old experiences. To help reduce your brain's automatic reactivity, you're going to use deep breathing exercises. When you feel anger rising, take a moment to breathe deeply. Deep breaths can help calm your nervous system and reduce the intensity of your emotional response. Inhale slowly through your nose, hold for a few seconds, and exhale slowly through your mouth. The fifth thing you can do is journal. Writing down your thoughts and feelings can be a therapeutic way to process anger. It allows you to express your emotions freely and reflect on them when you feel calmer. This can also help you with identifying patterns in your anger. This process is called affective labeling. If you need some help with this process, check out my Essential Tools card deck, which is available in my store, The Mental Wellness Space, and is linked to this video. It's a deck of 52 cards that includes affective labeling prompts and cards to help you more accurately identify your emotions. It also has a card for each of the 10 common cognitive distortions that you will use for the sixth thing that you can do, which is to use cognitive restructuring to reframe your thoughts. This involves challenging and changing negative thought patterns that fuel your anger. For example, you may be triggered to anger by reacting to things without much information on which to base your anger. This is called premature conclusions or jumping to conclusions, which is explained on card number 12. These cards are convenient to carry with you for reference. It even includes 8 grounding exercises that you can use to calm yourself in the moment if breathing doesn't do the trick. Number 7 suggestion is to use self-compassion. Practice speaking to yourself with kindness and understanding, especially after an anger episode. Acknowledge that managing anger is a process and it's okay to have setbacks. Engaging in physical activity can be an effective way to manage anger. Exercise releases endorphins and endocannabinoids, which can improve your mood and reduce stress. Number 9 is to seek support. Sharing your experiences with trusted friends or support groups can provide relief and validation. Sometimes just knowing that others understand what you're going through can be comforting. This process takes time. If self-help methods aren't enough, consider seeking help from a mental health professional. Therapy can provide you with more personalized strategies and support. Also, if you blow up a lot on loved ones, you may have some relationship repair work you need to do. If you are blowing up with your children, recognize that they will need more than an apology from you. They need to know that you are working to improve your reactions, but they may also need their own support or professional help so that they don't internalize your anger and become another generation of angry, depressed, traumatized people. The best thing that you can do, though, is show real change that remains consistent over time. It takes intention, self-reflection, humility, and patience, but that's the small cost of having meaningful relationships. Watch these videos for more on trauma. Thanks for watching today. See you next time.